shifting the narrative in the Puget Sound. You're listening to The Sound Shift. This is the second shift. For those of you who don't know, my name is Kenneth King. I am a certified behavioral health specialist. I'm a certified peer counselor. I work for the last 4 or 5 years now, I've been working in community-based crisis intervention, diversion, and system coordination and outreach coordination. Now, when I say community-based, what I mean is that I've been meeting our community members where they are, and that has been in their homes, in the outreach day centers, in the outpatient facilities, in the inpatient facilities. I've met people in hospitals, in the jails. I've met them at the police station, at the homeless encampments, everywhere. Tonight's show comes with a content warning. We're going to be having a sensitive discussion about suicide hotlines. Now, while I won't be talking about any explanations or examples of self-harm, it's still a sensitive discussion and one that might bring up feelings while we go through this. It might bring up frustration with the system. So please keep that in mind, and if you're not feeling up to it tonight, feel free to turn this off and just come back to it later. It's okay. We'll still be here. It's a recording. It works that way. Now, before we get into tonight's discussion, I want to talk about the show itself. Now, this is an experimental show. I've never done a podcast before. Many of the people that I will be working with have never done a podcast before. We've already hit a couple of road bumps. Those of you who signed in and listened to the first show when we started it and we did the live broadcast, you might have noticed that we accidentally unplugged the microphones. And so if we're going to put that up on the recording list, we're going to have to do a bunch of audio editing in order to make that work. As far as the schedule goes, we're not exactly sure yet. We're going to just kind of play it by ear the first few episodes and see what works and what doesn't. Stick with us. We'll try to be as regular as possible. We also want to schedule out with some other community members that are doing their own podcast for the first time as well. And so we want to make sure that we're not scheduling it in competition with them. We're splitting Sound Shift into 2 different shows. We're going to have First Shift and Second Shift. And First Shift is going to be more inclined to community voices and community discussions and what you bring to us that is non-systematic, but what's happening, here in our region. So the first shift is going to be, really in tune to community. I'm going to let the community take full run with that one as much as possible. The second shift, however, is going to be mostly me talking about system issues. Because of the fact that I come from this professional and personal experience background in the system itself, that is where I'm going to be bringing that scope or that lens that we're going to view these stories from. We'll also be doing Third Shift. And Third Shift will be a completely unscheduled bonus episode that happens every now and then based off of the stuff that is like immediate that we have to talk about, like stuff that just popped up in the news and we're so excited about it or we're so driven by it that we have to talk about it as soon as possible. As for Second Shift, I'm thinking it's going to be about a half an hour each episode. We're going to spend about, 10, 15 minutes talking about a couple of news stories or a couple of what's just happened this week. And then we're going to spend about 15 minutes or so, 15 to 20 minutes, talking about an actual system issue. Many of you who are listening right now know that I ran for public office recently, and for the year-long campaign, I made one promise, and that was that I was going to spend a lot of that campaign trying to educate our population on issues that we are almost seemingly purposely misled on. And I'm going to be trying to make sure that I'm also uplifting community voices and community concerns. While I didn't win that election, I still have that goal to accomplish. And so this is kind of how we're going to keep that momentum rolling. And I'm sure, as you can already tell, the recording quality of this episode alone has been drastically different beyond the different segments that have happened so far in just this 5-10 minutes of the show. Because as I've said, this is experimental, and the production value will go up as we get more used to doing this, as we get more experienced. All right, That being said, let's get started with tonight. On tonight's story, we're going to talk about 988. Now, for those of you who don't know, 988 is the National Suicide Prevention Hotline. 988 has been for a very long time a phone number that you can call when you're feeling at your lowest, and you should be able to call that number and talk with somebody, and they can, walk through the steps, process how you're feeling, and then maybe if you need, they can help connect you with emergency services or resources in your area. Now, in our state, unfortunately, this resource was not available. We just started this in 2023. 2023, House Bill 1134 initiated the process for us to join this national effort. And the effort was trying to start because it wasn't available in a lot of states, but we specifically knew we needed access to this program and this assistance. One of the big things that we did here in Washington was that we decided not only would this be a phone number that you can call when you are in need when you need to talk to someone, but it would be directly linked to behavioral health crisis resources in our state, so that when you called 988, it would be able to connect you with, counselors or next day appointments or intake assessments, stuff like that. Now, before we jump into the meat of this story, or the meat of this discussion, I should say, 988 is a program where it's based on operators. If you call from, say, Puyallup, whatever operator in the entire country is available is going to be who you get connected with. Now, it's going to prioritize a Washington state operator, but if there are no operators available in Washington, it's going to connect you to whatever the closest might be. And on top of that, our operators are also contracted county by county. And some of you might know that this is similar to how Washington state is doing its 911. Like, we have South Sound 911 in Pierce County, which is going to be a different 911 dispatcher operator system than King County. And in theory, if something happens at South Sound 911 and so the power goes out there, or, whatever, there's an emergency there, when you call 911, it's supposed to, then forward you to whatever 911 dispatch in our state is available that can then forward you back to the resources in your area. And these contracts are very similar with 988. And so in South Sound, in the South Sound area, in the Pierce County area, in the South King County area, we might call 988 and the dispatcher will actually be at the 911 offices. However, in King County and several other counties throughout the state, when you call 988, you're going to get dispatched through the operators at a company called Crisis Connections. Now, having looked at the contracts, from a shallow perspective that I have, the majority of these operators are certified behavioral health providers. They are certified to have these discussions. They are certified with, harm reduction first. They're trained on trauma-informed care. They're trained on open interviewing techniques. So the way that this program is supposed to work is that you call the line when you are in crisis, mental health crisis, and these operators, who are most that I can see here, most of them are also dual certified as counselors, are supposed to be able to, talk you down. And then after they talk you down, they're supposed to be able to connect you with resources, as I stated before. Now, the first year of these programs is always experimental, especially here in Washington state, where we did not really have this before. We had a couple of local operators that, they really tried. They pushed for these resources on their own, usually through their company, but this wasn't really widespread publicly available. But here we are in the second year, and now we are supposed to be seeing real establishing and real facilitation of these programs as it takes hold and becomes a permanent resource. Unfortunately, and this is my personal opinion and the personal opinion of many people that I have talked to in the behavioral health field, 988 is failing. I talk a lot about system programs. If you've heard me speak publicly, or if you've just talked with me over coffee or whatever, you know that I talk a lot about system programs and what's happening in our entire state, countywide, with contracts and such. Now, unfortunately, so much has happened with contract negotiations and new programs being established that 988 has become primarily a resource line, and we have lost the suicide line aspect of it. From a resource provider standpoint, I have been touting the success of 988 for the last year. I push everybody to call 988 if they're in trouble, to make sure that that information is publicly available. Many of my teams have been in contact with 988 and have been dispatched by 988 operators. Like, it is a good resource as far as, connecting with available providers. I'm not going to name who it was because of the fact that I'm very big on privacy and the right to privacy and disclosure issues. But the other night I got a phone call from a community member, and they said that they had attempted to call 988 with their friend. And their friend was very high need, very in a crisis, very suicidal. And the 988 operator, instead of, being able to talk them through the situation and being able to use those counseling techniques that I mentioned earlier, the 988 operator gave them a list of phone numbers that they should call instead. The 988 operator then dispatched police to the scene because it was an emergency, and the police, without using trauma-informed care or counseling or interviewing techniques, barged their way into the house. Now, everybody involved is okay, but it was still a very frightening and traumatic situation. Unfortunately, everything about this call is pretty much the opposite of how we originally advertised the 988 services. 988 was supposed to connect non-law enforcement, local crisis teams to the individuals in crisis, such as the designated crisis responder team. Unfortunately, it's a mess everywhere right now, and that's just not how it worked out. Now, I will not say necessarily that 988 has failed completely. There's still time, and this is still a very early program. Like, this is relatively new. Not even relatively, this is a new program. Like, we've only had it for now going on 2 years. And 988 is definitely still a good resource to call. We just need to be better at how we inform the public and how we interact with the callers. One of the major missing steps in all of these new changes in our system, not just 988, but the new crisis teams, the new crisis centers, the closing Western State, all of that, is that we are not doing a good job of communication and educational outreach to the community. I'm not going to just throw a resource out the window. 988 is still a resource. We need as many resources as we can get in our community. But we're going to take a moment and discuss how that resource works, but also what other resources are available, because of the fact that we don't have these conversations very often. Usually when you see something like this in the news, they're only talking about one program at a time, maybe one program that connects with, but they never really talk about how several programs work in tandem at the same time and how we as community members have the ability to reach out to those programs. Now, I will say that there are a lot of problems with a lot of the programs that I'm about to discuss, but we're probably going to talk about those in future episodes. Right now, we're just talking about options, okay? So in King County, you have the ability to call 988 or Crisis Connections. Now, both of those I think they're the same company that does the operations, but you might get a little bit of a different response when you call the different numbers. Crisis Connections or 988, we'll just say this hotline, is going to give you two real direct options right off the bat. And that's, do you need to talk to somebody? Or do you need resources? And if you need to talk to somebody, in theory, they should connect you directly over to the warm line, which is just for talking things through. And that warm line is open 24 hours. Now, if you need resources, they're gonna talk to you about that. Now, there is also the possibility that we can send out a crisis team. Now, there are 10 new teams in the King County area, and there are several crisis centers opening up. So if you are in drastic need of care tonight, and you are not a direct harm to yourself or others, but you just need to get somewhere safe, those crisis teams can meet up with you, and they can take you to a crisis center, or they can take you to a hospital, or take you to a safe place, or help you with safety planning. If you just need somebody to talk to, you can get connected to the warm line, and the warm line, you can just chat things through for a little bit, usually, half an hour worth of talking. And that should be able to help you at least get to a stable space in yourself so that you can make it to the next day where you can talk to family and friends, or you can talk with a professional. Now, in Pierce County, we have a little bit more of a mess because we don't have an integrated system like King County does. So if you call 988, we do have a warm line in Pierce County, but I honestly don't know who's manning it right now because it was manned by Recovery Innovations, and Recovery Innovations is the same company that was running the crisis centers, and we've just lost 2 out of 3 of those crisis centers. Right now, as far as I know, RI is only covering the ENT, which is an involuntary holding center, because of the absolute necessity of a crisis center being there for the first responders in hospitals. Other than that, they've dropped both of the voluntary crisis centers. So that warm line might not be available either. However, from what I hear, the 988 dispatchers are still certified as counselors. Unfortunately, also in Pierce County, we don't have a non-systematic law enforcement co-responder crisis team. We do have the DCR team through the MOCT team, MOCT, over at Multicare. If you Google that, you'll get the number to be able to call them directly through the Pierce County crisis line. They will be able to dispatch somebody who is non-police. It'll be a mental health provider and usually a mental health peer that will come out and chat with you that same night. But it is also possible that you'll get one of the co-responder teams, which is going to be a local police officer, and a DCR, a designated crisis responder, which is a mental health provider, master level education. And the sheriff will have the same thing. Now, unfortunately, already you can tell, just by the way that I'm describing Pierce County, is that there are so many holes in the system that are supposed to be supported by and support our 998 operators, that it's very clear how the things can start crashing down. And we do have the ability to start building these things up, because in Tacoma, unfortunately not throughout Pierce County, but just in Tacoma, we also have, I believe it's called the Hope Team, which is through the fire department, which is they do have mental health professionals. They come out with actual medics from the fire department and not police officers. Also, you can ask for the fire department in Central and East Pierce County. I've talked to the Central Pierce Fire Union, and they're all aware. They're the ones that usually get called out on crisis calls, especially if there's any sort of injury or possible harm to themselves or others. They can connect you directly over to the hospital, and you can start the process there. Any of these numbers, you can call yourself, you can call for a friend, you can call for a family member. These numbers are generally open to the public. Now, I have heard that there are negotiations happening with different companies on who is going to come down to Pierce County and reopen those crisis centers in the absence of Recovery Innovations International. But that's not going to happen for at least another 6 months or so. So here are the questions I want you to ask yourself, and I want you to ask the person that you're with if that person is in crisis. Can I, or can you, stay safe for tonight? Now that might look like, somebody is incredibly depressed and is thinking about self-harm. But for tonight, you put on a movie, you're going to spend the night together, you're going to keep each other safe, or you have the ability to just get some sleep or get some rest, or you have the medication that you can take, but you have a plan in place to stay safe for tonight. And if the answer to that question is no, then I want you to go ahead and reach out to the MOCK team or to the Hope team or to 988. They should be able to walk you through the steps of either having the DCR come out and talk to you directly, or going to your local hospitals such as Good Sam or Franciscan or Tacoma General or Wellfound in order to find a safe place to be for tonight where you are surrounded by professionals that can keep you safe. If you or the person that you're taking care of is in active danger to themselves or others, such as, already caused harm to themselves, already caused injury to themselves or others, call 911, right? We want to make sure that we get the medics out there, because we can't just travel while we're bleeding, so to speak. We want to make sure that you're being taken care of. Also, if there is a crime in progress, which includes, smashing car windows or attacking other people, that is when we want to call the police, because the police one of their main jobs is to secure the scene and to keep people safe until the medics or the mental health professionals get there. Now, this is unfortunately not the same as if somebody calls and says that they're feeling a little blue and they need somebody to talk to and the police are sent out to smash up their front door. That is the truth of the situation. We all have roles in this new system, and we have to stick with those roles and know our roles and also know how the impact of those roles affect the situation itself. If you are able to stay safe tonight, the next step is going to be making an appointment with a professional. Now, if you already have a mental health provider, call them up and make an appointment. Just be like, hey, I know I've got an appointment coming up in like a couple of weeks, but I've got some stuff I'm going through and I need somebody to talk to now. And you might not be able to talk to your provider specifically or your counselor specifically, but they usually have somebody who's got a little bit of an opening on their schedule that can back up your counselor. Okay, they can come out and they can talk to you, they can get things through, they can make sure to note what you're going through so that they can give that note to you, your counselor, so that your counselor's updated on what's happening. It's just extra support. And if you don't have your own provider, what you're going to do is you're going to ask for a next day appointment. You're going to be like, hey, I need to do an intake. Usually through 988, especially in King County, this is very possible. We're struggling, but we're getting there in Pierce County. You're going to ask for a next day appointment or an intake. And they're going to try to, right there, through the hotline, they're going to try to figure out who has the closest appointment available. And they're going to set you up on that schedule, okay? Now, this has been a tougher conversation. It's a very sensitive subject. I want to thank you all for having this conversation with me tonight. If you struggled with this conversation or if you're struggling in general, go through some of these steps. A safety plan for tonight. Ask yourself, can I stay safe tonight? If not, is there somebody that I can call directly, like a friend or a family member or even a coworker who I can trust to come and chat with me and to help me shake all this feeling off, or to at least help me stay safe for tonight? If not, go through the steps that we talked about tonight. There's also a lot of little steps that you can add in to help yourself kind of come out of that mode, or to at least help support your stability while you are in that mode. If you have things that you do to comfort yourself, a favorite movie, a favorite snack, maybe just being surrounded by friends in an environment that makes you comfortable. That could be a cafe, that could be a club, that could be your house, that could be your friend's house. But you are the only one that can identify those things that make you feel comfortable. Okay, that's it for tonight's show. I want to give a shout out to Kim and Penny, who have been trying to figure this out with me. Kim is probably going to be the primary host for the first shift, and Penny is going to be doing most of the production for the first shift. I will be doing the second shift and probably the majority of the production for the second shift. Kim and Penny will be also talking to folks and figuring out interviews and stuff like that, so give them a shout out. We're all in this together. Good night and good luck.